Hello, I'm Dr. George Muir from the University of Cincinnati, and this is a Society of Vascular Surgery briefing on lower extremity interventions for arterial disease. The first issue in lower extremity arterial disease is its recognition. The presence of peripheral vascular disease can be suspected in patients with atherosclerosis of the cerebral or coronary vessels, in smokers, in diabetics, or in people with a family history of vascular disease. In this setting, particularly in male patients over the age of 65, screening for atherosclerosis can be done by measuring the blood pressure at the ankle and comparing it to the blood pressure in the arm. This easy test can be effective screening for peripheral vascular disease in most patients. Occasionally, more sophisticated testing will be necessary, but we would recommend consultation with your vascular surgeon first. Lower extremity arterial vascular disease can be asymptomatic, can cause exertional symptoms referred to as claudication, or can cause pain at rest leading to the potential for ulcers of the toes or even gangrene. While asymptomatic lower extremity patients may have an increased risk of heart attack or stroke, no treatment is needed in the legs if symptoms are absent. Generally, we would recommend risk factor modification, including smoking cessation and an exercise program of daily walking in these patients. In the event that your walking is limited by exertional pain, referred to as claudication, then closer assessment may be needed. If your claudication interferes with daily activities, then treatment is probably appropriate. Generally, there are two alternatives for treatment of claudication: open surgical bypass or endovascular treatment. While both generally produce good results, open surgery is generally reserved for the healthiest patients. For the remainder, percutaneous endovascular treatment using balloon angioplasty or stents is recommended as a lower risk alternative, albeit with a lower long-term success rate as well. Fortunately, endovascular treatments can often be repeated multiple times to provide long-term relief of symptoms. If you have any questions about which treatment is best for you, contact your vascular surgeon and discuss it with him or her. Vascular surgeons are the only specialty that can offer all forms of treatment appropriate for lower extremity arterial disease, including open surgery or endovascular treatment if necessary. If you suffer from pain in your foot at night, then you may have a more severe form of ischemia referred to as rest pain. Rest pain typically occurs after lying in bed for several minutes. Often it awakens the patient from sleep, requiring sitting or standing to alleviate the pain or numbness. In advanced cases, the patient may resort to sleeping in a chair to avoid the discomfort associated with laying down. Eventually, if this is ignored, ulcers or gangrene of the toes will develop. It is important that this level of circulatory impairment be brought to the attention of your vascular surgeon to avoid major amputation. The vascular surgeon is the only specialist who can treat your lower extremity arterial disease in all phases. If conservative management is appropriate, medical risk factor modification and pharmacologic treatment can be provided. If limiting claudication is present, then minimally invasive endovascular intervention can be offered. If you need bypass surgery as the best option for you, your vascular surgeon can provide that treatment as well. Vascular surgeons have your vascular health and well-being at the center of treatment focus. Our goal is to avoid amputation and preserve mobility based on individualized care for each and every patient. Working together, we are confident that these goals can be achieved. To learn more about lower extremity interventions and other vascular disease, visit the Society for Vascular Surgery at vascularweb.org. This informational podcast has been sponsored by an educational grant from Cook Medical.